So I'm going to talk about a new platform. Before I start, anyone used Hydra before? Okay. Is it available in UAE? One? Okay, good. So my conflict of interest is that I've just done one. So we just started in Saudi Arabia with the first case, and I'll tell you what is the data shows currently and what is the data gaps, and how Hydra valve different from the current platforms in transcatheter heart valves. So it's a self-expanding supraannular bovine pericardium with skirt, and it received CE mark June 2020. Sorry. It has three tentacle design where the hooks are for the delivery is attached to it, so you can navigate through the aortic arch. We're going to show you a case how easily it can maneuver whatever the angulation of the aorta and the heart orientation, whether it's horizontal, extreme or not. It has large frame cells. It facilitates easy access to the coronary arteries. Supraannual valve that presume that have optimized hemodynamics, and the other thing that it has two radio-bake frame markers, and the lower one and the upper one. Upper one help you to tell you where's the valve. It might help you in the future if you want to do valve-in-valve planning. You understand where you're going to position your second TAVR valve, and it has an extended internal sealing skirt. In addition, by theory, because of the non-flared inflow part compared to the other self-expanding platforms, the theory that it reduces conduction abnormalities, and we're going to look at the data. It's a 14 French delivery sheath, non-braided, transparent, and it's very easy to deliver. That I felt for the first case. It is an inline sheath. It can take up to 5 millimeter access, and the way it is really user-friendly for early career, we're going to do TAVI. It's very easy to learn compared to the other platforms, up to my opinion. And you can see here, you have where the red marker tell you there's the no. That's where you're going to reach. No return if you reach to that, and it's just a roll of the blue knob, and then the black knob after you release the pin is where you confirm that you took out the hooks from the valve platform. So this is just going to show you the pin, and here you can see how the delivery and the valve distance upon retraction. So here you can see how it kinks over there. You can see that's normal with Hydra valve. I tell you how really flexible it can go through. And there's just some details about the height, the diameter, that with the different sizes of 22, 26, and 30. This is an example of how and positioning. The same thing you go with a cusp overlap. And here you say you think it is low. It actually, this is how it should be looking at the. If you notice in the previous slide, the inlet skirt and the valve usually start in the higher, so the knot is a bit higher than usual compared to the other platforms. For commissural alignment, you can see where we want to look at is that you have a near 1, 2 dots. If you look at the 2 dots that is on the right, that goes more, that's where you want your commissural alignment. If not, you need to maneuver your valve accordingly. So there was two non-randomized trials where they look at the first trial where they look at the safety and efficacy of the valve. And you can see here at 30 days, 3 months, 6 months, the pacemaker implant about 7.5, which goes with the novel design of the inflow of the valve. The gradients up to 6 months, pretty consistent. And the paravalvular leak, about a third, that mild, that goes away after 6 months, down to 3%. So it's a prospective, multi-center, non-randomized. That's for the second Genesis. And here, they're more smarter. In the first trial, they included people, operators that are not really experienced in TAVI. And in this setting, they have more experienced TAVI operator, and it's a small number though. And you can see it's the efficacy and the paravalvular leak, almost 10% at 1 month. If you look compared to Genesis 2, the mortality rate went down to 2.5, and at 30 days, about 2.5, the same thing. And you look at the Hydra CE study, post-marketing, about 150 patients, a follow-up of 5 years of 41. They have equivalent mortality rate to partner 3, almost at 3 years about 15%. But if you look at the 5 year, it's a bit higher than the other platforms. The hemodynamic performance are consistent over the 5 years in the Hydra CE study. And the paravalvular leak, if you look at the 5 years follow-up, was about 24%. Regarding symptoms, so there's you can see the dramatic improvement compared to baseline after the procedure, from 70% in OHA class 3 to 22%. So I'll show you a case where there's a horizontal aorta. That's a pre-dilatation. Usually, routinely, you're going to do that to avoid any deformation of the valve. And during implantation, the same as mentioned earlier, the marker during unsheathing, you want to target the annulus.
So Waleed, we have 2 minutes. Sorry for disturbing, but
sure. No, almost done. Yeah.
Thank you.
And if you can see, it's a bit deep. So another attempt. Actually, not deep. And the left side is a bit high, and on the none is about deep. And then repeat it again, and you can see the movement. And it's better just to do a second attempt with more rapid pacing, given the horizontal aorta. And you can see here, and post-dilatation, and aortogram after the post-dilatation. This is all central AI, but it's very difficult orientation of the heart, but it made it through with this flexibility of the valve. And until we have a randomized trials on the way, we'll see how the valve performs compared to other platforms. Thank you.